One of them had used the medicines that I gave her, but didn't have any relief and said, I think I have a sleep disorder. My husband says I snore like a train. And she was young, healthy, didn't have a fat neck. She was in her middle 30s. There was no reason why she should have sleep apnea. We were not being told to look for sleep apnea in that population. And frankly, I didn't think sleep really was applicable to my patient group. So I sent her for a sleep study. She turns out to have sleep apnea. She puts on this torture device and she comes back 3 or 4 weeks later saying, my headaches are gone. And I was just blown away by that because I have this very biochemical view of how the brain works and what migraine is like. And I've been doing headache for a long, long time, and my medicines are supposed to work. Yet I also know they don't exactly. They wear off, they're temporary. And so she puts on this torture device that, in my view, can't have a placebo effect. Okay. You cannot strap on one of those things while you're sleeping and go, oh, this is wonderful. Nobody wants to do that. Her headaches went away. So that started a journey where I thought, I got hundreds of other patients with daily headaches. I'm just going to start doing sleep studies on them. And if they have sleep apnea, I can treat them. Well, they didn't have sleep apnea. Most of them did not. So this population is young, healthy females. Most of the people with daily headache are young, healthy females. They've had a couple of kids. That's about it. I start doing sleep studies on little kids with headaches, teenagers, and some males. And as I start to do more and more sleep studies, I realize, and it takes a while, they don't have sleep apnea, but they don't have normal sleep. And that takes a couple of years before the pulmonologists, so that it's the lung doctors, because they were on the machines, that had gotten into this sleep apnea. That means when you don't have the right phases of sleep, but you don't stop breathing, they just don't put it on the report. Okay. My pulmonologist says to me, hey, I don't know if you've noticed this, but your patients don't have as much rapid eye movement sleep as they should have. And sometimes they just stop breathing in rapid eye movement sleep. And I'm like, well, that's not on the report. And he says, yeah, I know. And I'm like, wait. I've sent you hundreds of people. Their sleep studies are abnormal. And you've sent me a report that says no significant apnea. That means I have to really completely change the way I'm thinking about it. So it started with apnea. But now that I've done hundreds of sleep studies, and these young, healthy people have a very specific finding. One, most of the time, their complaint is, I wake up at 3 a.m. and I can't go back to sleep, if they have a sleep complaint. The second complaint is, I sleep, but I'm tired. So they aren't snoring. They don't have the typical things that would alert them to having a sleep disorder. They just don't feel as good as they used to. A lot of them are heavily trained, long distance runners, CrossFit. They're doing all the things that everybody's told them to do with their diet and their exercise, but they still feel tired, or they can't remember, in a bad mood.
DoctorsToTrust.com. Please share this video with loved ones.